This is a public service announcement about the hospital ICU capacity in the United States. Now, there are plenty of hospitals who are not having a problem, they're just fine, but there are other hospitals who simply cannot say that.
COVID hospitalizations are at an all-time high here in Louisiana.
Just 1% of those ICU beds are available for patients in the state.
Our numbers have gone up, our beds are full.
This center is usually open 24/7, but the sign that says it is covered now, and there's a sign in front of the door saying that it's closed. They had to shift all personnel to the larger campus.
And I walked down the halls, and I'm not exaggerating, I saw people in beds in the hallway with oxygen.
You know, many nurses are deciding that they can't any longer do this.
The nurses being overworked in a sense and exhausted and tired, and they simply can't keep going.
One of my colleagues this week, he was trying to transfer someone. He had to call 25 hospitals and then to be turned down by 25 hospitals all the way to Atlanta, to Nashville, Birmingham.
During these challenging times, you should be familiar with the ICU capacity in your local area. If your area is having a shortage of ICU capacity, perhaps it is time to start thinking differently about safety. Now is not the time to need a hospital. If you take medication to prevent a heart attack, seizures, or other serious conditions, it's extra important right now to take your medication according to schedule. Also, try to avoid activity that may result in severe injury, like texting and driving. Crashes, accidents, other things that previously were survivable perhaps, they're less so now because limited healthcare resources has very real consequences to your level of care. Many mothers and fathers innately have promises to take care of their family. It is now time to think upon those commitments. While we believe in the effectiveness of vaccinations and the use of masks, we also understand that many people do not share this belief. And so this message, it is not an attempt to convince you, to encourage you to vaccinate. This message is just to share the understanding, to communicate the thought that society's safety net in some geographies, in some places, that safety net, it is starting to rip.
Everybody has to realize this is not a good time to get sick.